cord, which I think is a good idea.
Don't they do that with the placenta as well?
I don't know for sure. I think that's now an option also. And I know that it's an option, like to let them preserve or use it, meaning stem cell. Just like the chorion, okay, the amniotic fluid, okay. Some women choose to donate some of their fluid, which becomes a source of stem cells that can be used a lot in medicine now. Have y'all heard of that? Okay. That was an option I chose. It was last summer. I chose to use the chorionic stem cells in my knee. So, you know, I've got the degenerative arthritis and all that sort of stuff. And because I still have cartilage present, that was presented to me as an option. And the goal is, it's a stem cell that when, you know, used in this area of my body, it will be exposed to the cells there and help with hopefully reversing some of this degenerative process. So I won't know until this summer, because you have to wait a year, okay, and redo the MRI and all that sort of stuff, and you see if there's been any change, and if it is, you choose to either do it again or not. So, the adult connective tissues, we're going to now move into those. The adult connective tissues. Okay, so connective tissue proper, loose, dense, supporting cartilage, bone, fluid, blood. So now as we move into these, this is what you would see under a scope. So if you were looking under the scope and you saw the loose connective tissue, this areolar, and remember, one of the places that it's very abundant is under our skin, okay? So it is loose packing. We do see that it is found with most organs and tissues, also known the term stroma, okay, a fluid, all right? It attaches the skin to underlying tissues, which is going to, you know, be muscle. So it's going to help create the connection because this is connective tissue. We're going to find for the skin, we have what's termed a fascia. When you hear the term fascia, that means a sheet of something, all right? So for under the skin, we have the hypodermis. The hypodermis is termed the fascia. It does contain collagen, reticular, elastic fibers, and all of the cell types, the ones that are helping with immune and everything. We do often see it associated with other connective tissues, like the fat cells of the body, reticular tissue of the body, which we'll see a lot with organs. It will include, now let's take some of this apart. Fibroblast. What does the term fibro make you think about? Fibers. How many do we have? 3. The 3 that we have: elastic, collagen, reticular. So that's something that we're hopefully going to keep remembering. We've got the 3 fibers: collagen, reticular, elastic. So that lets us know the fibers. What does the term blast let us know? It's immature and helps give rise to the fibers. So if it's fibroblast, that will help it give rise to the fibers. We're going to find the mast cells, the lymphocytes, adipose, macrophages. That is what you would see in our loose connective tissue. In the loose connective tissue, we say that the adipose has special properties because when we look at adipose tissue, for the most part, of course, they are fat cells, adipocytes, which contain fat droplets. All right? Now, because we say special properties, it's because we have one that is termed yellow or the whitish fat tissue, and then we have the brown. The difference in the yellow, which is our most abundant in the body, at birth it's white, but it gets yellow with age, okay? This is because the fat cells can store different pigments, colors, okay? For example, foods that we eat, carotenes, like carrots, squash, anything that might be the yellow oranges family, because that is the product that it is, the body will store that in the fat cells. And people who have you ever known, like, somebody who might eat a bunch of carrots or something and they actually have an orange appearance to them? It's because their fat cell is storing that pigment. And vitamin A. We have other vitamins that are stored in the fat cells that are important. Vitamin A we mentioned because that's so important to sight. All right? Shortages of it can lead to blindness. We're going to see that in the structure of the adipose cell, it actually looks like the cell is an empty space, okay? But that's because this space is the fat droplets. The plasma membrane is surrounding it and then pushed to the edge of that plasma membrane because of the fat in the cell, you'll find the nucleus. So it kind of looks like it's got an empty space in it. Now, the brown adipose tissue. The reason that it is brown is because there is a blood supply. Okay? It's only going to be found in specific areas of the body. Axilla, does anyone know where that is? Under the arms. Okay? Neck and near the kidneys. Their cells are a little bit different in shape. They have a lot of cytoplasm, quite a few of the lipid droplets. Nuclei are usually pushed to the side, but the difference is the blood supply. There's a blood supply that's present. So they're found in areas of the body that are using that.
Is that like the armpit? You said like the underdog.
The what?
You mean like right?
Yes.
Yeah.
This would be axilla region. Now, under these connective tissues, reticular tissue, note how we have this webbing structure that I keep mentioning. This is found. Look where it's found. Lymphatic, hemopoietic, lymph and blood. Each one of these is very cell-based. Red blood cells, white blood cells, okay? The network that it's going to form becomes important to the structure of that organ, which you'll learn about later. It creates space. This becomes important for the cells, especially white cells in the lymph system, so that they can actually do their job. So that becomes interesting. Under our dents, because remember, we had the irregular and we got the dents. Dents means the fibers present have a structure. And the loose, they didn't. The loose were simply fibers being dispersed. Under dents, they now have a structure. If it is a regular structure, one, like we can see here, creating nice little waves, okay, it would be dense regular. Lots of collagen fibers, because collagen is the toughest fiber we have. This creates our tendons and ligaments, which of course work with muscle and bone. And we put a lot of pressure and stress and stretch on these tendons and ligaments. Okay? So, the tendon's job: connect muscle to bone. The ligament, connect bone to bone. Tendons and ligaments. We will definitely continue with those as we move forward into our cartilage and our bone. The dense, regular, elastic. What that's telling us: dense, lots of fibers, regular, in a pattern, and elastic, the fiber that is present. So dense, regular, elastic. What we find in our vocal cords, and then the nuchal ligament. Anybody know what that one is? It's back here, between the head and the neck. The nuchal ligament. One that a lot of times we're rubbing because we're so tense and stressed out. Makes it hurt. Yep. There are a few collagen in the vocal cord.